Yeah, so at Delamere, we've seen a real spike in the number of people that are searching for terms around pornography addiction. And we wondered, whether this was something that only we were seeing, and our web team used some wizard tools to benchmark our traffic versus the kind of global search for pornography addiction. And here in the UK, what one tool is telling us is that there are nearly 2.5 times the number of searches for pornography addiction than there are for alcohol addiction. So a dramatic increase in web users searching for information about pornography addiction, signs and symptoms, and also how pornography addiction can be treated. We think it is a true reflection. The number of people using pornography and the spike around pornography use has been well documented. So for some of those who are using pornography, their use will have become chronic, it will have become excessive, and they'll be experiencing consequences as a result of that compulsive behaviour around pornography. So one would imagine that the search and the information they're seeking is because they recognise that the consequences of their behaviour are beginning to catch up with them, and they need and want to make changes. I think it is concerning. I think it's, on the basis that the consequences can take quite a long time to catch up with people. In terms of why we're seeing such a spike, I believe that spike started during COVID when people were, so very isolated, lonely, anxious. We saw a spike, didn't we? An increase in the use of pornography. What we would say is that if the use of pornography is negatively impacting somebody's life, if they're experiencing consequences as a result of excessive use of pornography, and they've lost control around how much time they spend using pornography, and they're not able to either stop or set limits around their use, then, it has become a problem. And it follows that if they can't stop on their own, they need professional help. We've seen people who've literally lost their relationship as a result of the use of pornography. We've seen people who've become extremely isolated, extremely withdrawn from life. It can affect people's ability to turn up to work. So, yeah, the consequences can be really serious.
I guess that's one of the big myths. Sex and porn addiction has actually got nothing to do with sex. It's not about sexual arousal. So sexual arousal is, yes, there's some dopamine involved, but primarily sexual desire, sexual arousal all comes from testosterone, whether it's male or female. It's a desire that comes from the genitals, whereas addiction is to do with the brain. It's to do with the reward centers in the brain rather than reward centers in the genitals. For somebody with porn addiction, the way that they often describe it is that actually it is the seeking, it is the searching that they get addicted to. So they're going to log on to a website probably because it's a way of escaping something else, some other uncomfortable. They're bored, they're feeling lonely, they're feeling stressed with work, they're not particularly horny. That's not the motivation. It's coming from some other kind of stress, anxiety, loneliness or something. And then they're going to be looking at porn probably for hours on end. Now, if this was about sexual desire, you wouldn't keep postponing orgasm for hours and hours. That would be a bit like if you were really hungry, cooking yourself a meal, putting it in front of you and going, you know what, I'm not eating that, and just sitting there and staring at it for hours. It'd be ridiculous. So somebody with porn addiction actually is probably going to keep postponing orgasm for possibly hours on end. It starts with porn, but then it escalates. So it goes into the chat, it goes into the webcams, it goes into the hookups, it goes into visiting sex workers, it starts costing money, it escalates, it causes more and more problems in someone's life. An official definition in ICD is the International Classification of Diseases document. It's kind of the Bible of mental health. And what it says in there is that you need to have had this problem that is causing significant distress in your life for at least 6 months. So it needs to have been a problem for at least 6 months. It's not a problem because your partner doesn't like it, but you think it's fine. It's not a problem because you went on a bit of a bender and had a bit of a binge, but then you pulled yourself together. So in some ways, I don't think it would be right to have very, very clear symptoms. I think people know, they know in their heart of hearts when I need to get a grip and I can't. That's when you know it's a problem.
I think with pornography, what makes it often a little bit complicated is that there are consequences. The consequences of what I would call pornography addiction tend to be psychological. So at the point where somebody is dependent on alcohol, for instance, the consequences of addiction tend to catch up with them very quickly, to the point where they need hospitalization, they need a clinical detox to stop drinking safely. If they don't have access to alcohol, they're physically unwell, etc. That tends not to happen with pornography. So that the consequences can take quite a long time to really manifest, and it can take a while before somebody's able to take an honest look at their behaviours around pornography and join up the dots and say, actually, this is really starting to affect my life now. So I think it can sometimes take quite a long time for people to realise that it's become a problem. We have a 3-phase programme which we call Stop, Start, Grow, and it really helps people break the cycle, understand where the problem is coming from, and then have a way of living or a toolkit that enables them to stay safe and well moving forward. The other options that are available is things like support group meetings. So being in active addiction is an extremely lonely, isolating, confusing experience, and there are lots of support group meetings that are free to attend where people can go and immediately they'll be introduced to a network of people who've been through something similar, who are actively working a recovery program. And that's really helpful, that identification, whether it happens in a treatment centre like we have here at Delamere in Cheshire, or whether it happens in a support group meeting, is so very helpful, because especially with pornography addiction or sexual compulsivity, it is the shame that keeps people from seeking help, keeps people locked in that cycle of active addiction. If anyone out there is concerned about the amount of pornography that they're consuming or the amount of time that they're devoting to the use of pornography, what they need to do really, I would suggest, is take an honest look at what is happening for them and try and set some sensible parameters around their use of pornography. If they're able to keep to those and they're able to moderate their use of pornography, then it shouldn't be having any sort of impact on their life. If they're not able to set limits, they're not able to moderate, that's the point at which really they need to start thinking about inviting some sort of professional.
The real critical difference is that obviously the solution is not to stop having sex. Heaven forbid, that would be terrible. So whereas with drugs and alcohol, it's about abstinence, it's about stop doing that completely, and it's quite easy to know what you should do and what you shouldn't do and what you can do, what you can't do. But obviously with things like sex and porn addiction, you're still a sexual human being. So actually, how do I enjoy my sexuality in a way that is not going to be triggering for me and is not going to cause other problems in my life? So that's the big difference, is that it's not about abstinence, it's not about sobriety. Other research has been done that shows that one of the biggest barriers to seeking help for people with sex and porn addiction is the shame and the stigma around it. Walking into your GP and saying, I think I'm a porn addict, is just really difficult. It's much easier to do with drugs, alcohol, but it's much harder to do with porn. So the digital health solutions are really important in terms of overcoming that stigma and that shame. So I hope we will see a explosion of people seeking help the more they get to know that there is actually a resource out there for them.